ready to deploy at any time. Forward Deployable Preventive Medicine Units, or FDPMUs, are a vital asset for the Navy and Marine Corps. FDPMUs use state-of-the-art technology in the field to assess, identify, and implement programs to reduce natural health threats and industrial health stressors. The history of these teams are rooted in the development of epidemic disease control units, EDCUs in the late 1940s, and the deployment of fleet-based EDCU No. 1 and No. 2 during the Korean War. Today, FDPMUs are attached to the Navy Environmental and Preventive Medicine Units, or NEPMUs, in Norfolk, Virginia, San Diego, California, and Pearl Harbor, Hawaii. There are 6 active-duty FDPMU teams, each consisting of 13 elite medical experts, 3 teams at NEPMU 2 in Norfolk, 2 teams at NEPMU 5 in San Diego, and 1 team at NEPMU 6 in Pearl Harbor. Each coast has 1 team ready at any time to deploy within 4 to 10 days. In addition, there are 2 newly reformed reserve teams in both the East and West Coast. When deployed, the FDPMU assesses the risk of adverse health outcomes through a variety of testing methods and monitors the health of deployed forces. In addition, FDPMU teams make recommendations based on their findings to the operational commander and can provide continued support with specialized preventive medicine that can be deployed using portable, state-of-the-art diagnostic equipment. FDPMUs are mobile. Their unique hub-and-spoke model and tent camp structure enables teams to remain agile and be able to move further forward quickly. FDPMUs can adapt to meet any contingency on land or at sea, helping Navy and Marine Corps personnel maintain readiness in any deployed environment. FDPMUs are comprised of 4 components: preventive medicine, chemical, microbiology, and disease vector. There is also a logistics support module to help manage all components and communicate with on-site command leadership and back to their own command. Each of these components has a very specific task, with all operations laid out in a strategic tent camp design for maximum efficiency. The preventive medicine component provides expert consultation to prevent or limit the impact of disease outbreaks. The preventive medicine team utilizes field sanitation expertise and assessment, epidemiological investigation of disease outbreaks, and theater surveillance data analysis to develop and recommend interventions for prevention and control of deployment-related occupational and environmental illnesses, injuries, and diseases. The chemical component provides capabilities for the health risk assessment associated with chemical warfare agents and environmental and occupational health hazards. The chemical team also evaluates potential short and long-term health risks associated with environmental occupational exposure pathways and provides recommendations to minimize those risks. Field confirmation testing for a variety of chemical compounds is also available with the chemical component team. Part of the chemical component is the radiological subcomponent, which assesses and identifies radioactive material, advises of the hazard level, and recommends countermeasures. This subcomponent also provides consultation for establishing an environmental dosimetry surveillance program and protective measures. The microbiology component is a mobile lab within the FDPMU that can identify pathogens associated with biological warfare release and disease outbreaks, as well as providing clinical microbiology diagnostics in operational environments. The disease vector component identifies and controls disease vectors in operational situations through risk assessment, surveillance, and pest control treatment programs. Disease Vector also establishes and maintains reach-back capability with subject matter experts for vector, vector-borne disease, and vector control assistance as necessary. FDPMUs provide this necessary preventive medicine data to commands in an effort to help keep deployed service members safe from insects, contaminated water, airborne disease, and other environmental hazards. But FDPMUs are not just needed during a conflict. Their use cases are widespread. In addition to helping the front lines, FDPMUs are also sent to assist in a variety of disaster relief and humanitarian efforts around the globe. From hurricanes to floods and everything in between, FDPMUs are a key component to keeping people safe and healthy from environmental and biological hazards. Whether it's support during deployment or after a natural disaster, FDPMUs are ready to respond quickly with public health experts that work to keep even the most dangerous environments safe. Forward deployable preventive medicine units. Anywhere, anytime.